Hello, welcome again. Um, so we'll start speaking about the personal history in a little bit of details, and now it's time to understanding what we are doing. So the first item in the personal history is the name, and why you're actually uh, speaking to the patient and knowing the name, and the purpose of that is to make sure that you are dealing with the right person. So it's the identification and registration check. But at the meantime, to call the patient by his name would be nice. So to be familiar with the patient in conversation, people like that. They like you to call them by name, and so they can relax while they are talking to you. So name is very important to know, not only from the medical legal prospect, but also to familiarize yourself with the patient. So what about the age? Now, age, to start with, you need to know the different age groups. And in this table, you can identify that infancy is from birth until 2 years, childhood is from 2 years until 12 years, adolescence from 12 to 20, so you've got all of this period, infancy, childhood, and he's walking to adolescence. And then you've got the mature nice period from 20 to 40, and that's your adulthood, where everybody's enjoying themselves. And then you've got the middle age, not the middle age time, but middle age, which is the 40 to 60 years old. And then you've got the best age, which is above 60 years old. Now, why do we need to know about the different age groups? And the answer will be because uh, age has got a predilection to pathology, and it has got a predilection to the type of pathology. So you can find different pathology in different age groups. Like, for example, you can find congenital anomalies in infancy and childhood. Inflammation is more among adolescents and adults. And as you go to the middle age and the older group, you will find more of malignancy. Coming to the type of the pathology, like in the young area, like in breast, it's more towards fibroadenomas, while as you go older, it's more towards malignancy. Speaking about thyroid disease with enlargement of the thyroid gland called goiter, you've got more of cretinism in this age group, which is in children, physiologic goiter in puberty, nodular in adults, and cancer in old. So different pathology, different type of pathology in different age groups. This is why the age is important. It's important to know and to be familiar when you talk about it. And then coming to the third item of the personal history, which is sex. Does it have a specific relation to diseases? And the answer is definitely yes. So the sexual organs in males are different from females, and so the diseases are as well a bit different as regards symptomatology and signs. So pelvic inflammatory diseases comes more in ladies rather than in men, which are affected equally with the sexual transmitted diseases. Pathology predilection to sex, like if you look to the thyroid and breast diseases, they affect more ladies rather than men, while the gastric problems and burger diseases affect men more than ladies. Even the burgers are more or less peculiar to men. Residence is important, whether race or religion or nationality. And these are some endemic diseases which are more or less uh, spread into their specific areas. So in Egypt, you've got more than about schistosomiasis. In Iraq, heart disease. India, you've got more of TB. Europe, cancer colon. Japan, cancer stomach. Jews, you can find more of cancer cervix and penis and Berger's disease into Jews. You need to ask about a history of traveling abroad, because somebody who can be coming to you with abdominal pain and diarrhea might have attracted some sort of parasitic infestation somewhere, or getting in contact with a person who's had TB, like for example traveling to India, or might make this patient a carrier if he came with hemoptysis or with cough, rather than to think about cancer of the lungs. Occupation, is it important? Yes. So people like teachers and surgeons who stand for a long time, they might be liable to varicose vein, with the effect of the gravity affecting the colon of blood, and the same for hernias. Porters as well, they are more liable to that. Raynaud's, which needs lots of vibrations. People who are dealing with drills or playing piano. And then we come to the sixth element of the personal history, which is the marital status, whether single, married, or sexually active. And this will tell you a bit about the hormonal imbalance, sexual diseases, and some might probably be relevant to psychological problems, which might give you a differential diagnosis in case of pain or others. Also, you need to ask about obstetric history, abortions, ectopic pregnancy, method of delivery, and all of this share into identification of the reason if a lady comes with abdominal pain or bleeding from her vagina. Also, you need to ask about primary or secondary sterility, as this might give you a clue for diagnosis of endometriosis in ladies who come with abdominal pain. Special habits, you need to ask about the bad and good. So, smoking, how many, how long, this might produce cancers. Alcohol, how much, how long, might produce pancreatitis or cancers as well. Addiction and drug abuse, which can produce hepatitis or abscesses. Sleeping pattern, this might be affected by the psychological element if you think about a psychological problem as being a differential diagnosis, or if the sleeping pattern has been affected from a disease like cancer, for example, which preventing people from sleeping properly, and you might need to direct your patient towards somebody to help. Diet, obesity, peptic ulcer, piles, all of this is diet related, and exercise as well, whether your patient is in exercise or not, because this might affect the muscle and might give you an idea about possibility of might be a cause of a hernia, or whether the muscles are in a good shape to be operated upon using some sort of a repair of a hernia rather than another, and we'll come to this later on. Menstrual history is your eighth item in the personal history. You need to ask about the age of menarche and menopause, whether early or late, and this might be a risk factor for breast cancers, for example. Menstruation regularity, and you need to ask about frequency, duration, amount, and this will give you an idea about pelvic inflammatory diseases and fibroadenosis. And we'll go into the differential diagnosis of abdominal pain, of course. And beside getting some information about your disease, it will allow you to schedule surgery, because people might not like that you operate on them while they are in the middle of their period. They might have bad moods. for example. So this will take us to the end of our lesson, and as we have been used, it's a time of questions, and I would like you to answer those questions after properly understanding the lesson, and it will tell you why do you have to ask about the name, can you remember age groups, uh, can you give me one relation of age to pathology, why do we need to be aware about sex of patient, give me examples of occupation affecting pathology, how residency would affect the pathology, would pathology be related to marital status, what personal habits would you ask about, and how can you take a menstrual history. This will take us to the end of our lesson today, and see you in future lessons. Thank you.